Hey guys, I recently matched into dermatology and I have been getting some questions about what my story is, what really brought me to medical school, what made me apply for dermatology, and I've been asked a little bit about some tips and tricks for the application process, so I was going to speak with you a little bit about that today. So first I'm just going to tell you what my story is, how I came to medical school. I actually, in undergrad, did not study science. I studied music, marketing, and French, and I went on to work in business consulting. And I did mostly healthcare consulting when I was in business, which really, for me, sparked the interest in healthcare and deciding to go back to medical school. But when I went to undergrad, I was not thinking that I would be applying to medical school, but worked in hospitals. I was working with CEOs of hospitals, working with nurse managers, working with physicians, and I found that I really enjoyed healthcare and I wanted to make a difference in people's lives on the clinical side of things. So I went back to school and I did about 3 years of post-bac classes. So I did my basic biology, basic chemistry, took the MCAT, and then started medical school. And I really kind of first became interested in dermatology during first year of classes. So I went into medical school really having no idea what I was going to practice right away. I don't have anyone in my family who's a physician, so I didn't have anyone telling me I needed to go into ENT or I needed to go into dermatology or I needed to be an orthopedic surgeon. So first year I really kind of fell in love with the dermatology lectures. We had some great lecturers at my school and you could tell they really enjoyed what they did. I liked the detail of some of the dermatopathology, looking at the layers of the epidermis, and I liked the pictures. Dermatology is a very visual field, and if you like looking at pictures and trying to solve a puzzle based on a picture, dermatology can be a really good fit for you. And I found that for me, that was something I really enjoyed, and it stuck out during the first 2 years of lectures as something that I really enjoyed more than other lectures in different specialties like pulmonology, nephrology, things like that. So I went into third year really not knowing what I wanted to do, but I tried to keep an open mind. So I started with OB and I fell in love with that. Then I had my derm elective, which I absolutely loved. And then I had pediatrics, which I loved almost as much as dermatology. So I, at that time, was thinking maybe I'll do derm, maybe I'll do peds, and then I had surgery, and then I thought, well, maybe I'll be a surgeon. I love this too. So that kind of was how my whole third year of medical school went, and I had to do some soul searching to figure out what specialty would be best for me. And I think especially having had a different career path, coming back to school, I really wanted to find something that would be fulfilling and that I would want to do for the rest of my life. And for me, the more I thought about it, the more I realized that dermatology is the coolest specialty because it combines pretty much everything else. You still get to do pathology. Not many specialties allow you to actually look at your own slides and come up with a diagnosis just based on looking at them. Outside of pathology itself, obviously. You get to do procedures, so I loved doing procedures. I loved being in the OR during my general surgery rotation, and that's something that you get as a dermatologist. You can go on to do Mohs surgery, or you can be a general dermatologist but still do a lot of biopsies, which I think are really fun. And you also get some really complex cases. So I think we all think of internal medicine as a specialty where you're seeing these really kind of unique, complicated patients that take a lot of diagnostic effort, but dermatology has a lot of that too. So I think for me, it really had the best of all worlds, and I decided to pursue a research year kind of halfway through my third year of medical school, partly to decide if dermatology really was the right choice for me, and partly because I'm really interested in academics, and I think the research process is fascinating and is important to push the envelope and keep the field of dermatology and really medicine in general going. Instead of just providing good care for patients, we need to come up with better treatments, come up with better ways of doing things. So for me, doing a research year really fit a lot of my interests, and I decided to pursue a pediatric dermatology research fellowship because of my strong interest in peds. When I really thought about my third year of medical school, dermatology and pediatrics were the two specialties where I felt at home, and I felt that I would really love what I was doing every day. So I did a peds derm research fellowship and have no regrets whatsoever about it. It's something I would recommend to anyone applying dermatology. You get some great mentorship, which is very important. I have the most wonderful mentors I could ask for who gave me great advice and really have helped me helped me match and helped me learn about research and academics, and have really sparked a lot of interests for me that I didn't even know I had, and have positioned me to really have a great career in dermatology and in pediatric dermatology more specifically. So I think, for me at least, research was a great opportunity, and it's something that a lot of people applying to derm are now doing, and I think overall a great decision for me. So I did my research year, came back to the fourth year of medical school, and I did my home rotation and then did 3 away rotations in dermatology, and kind of right after that led into the interview season. Going into the application process, I knew that I should apply very broadly, so I applied to a lot of dermatology programs. And for me, I found that doing my research year was incredibly helpful because I made a lot of really good, close connections with dermatologists throughout the country. And I think getting to know those people really helped not only get interviews, but to feel more comfortable during the interview day, already having a familiar face and knowing someone there. Now I'll go over a few questions that I received from people who are also applying dermatology. So one question is, do I have to do research or even do a research year to match dermatology? I think that's a really great question. I think a lot of people get the advice that they need to do a research year. I think, at least for me, it was incredibly helpful because I gained great mentorship, I got great advice, I had good experiences that I wouldn't have had otherwise, but people do match without a research year. Most of them have done some kind of research, not all, but I think that the majority of people do have some dermatology research going into the application process. Another question that I received is, do I need to do away rotations in dermatology? I think that's also a great question, and I think it's very person dependent, but away rotations are a way for your name to come up in a stack of papers with applications when 600-700 people apply. If you do an away rotation, people know you there. Away rotations can be a double-edged sword. If you make a bad impression during an away rotation, that can hurt you, but most people applying to dermatology do away rotations, and you should talk with a mentor to figure out what the best locations to do those are. The next question I got is, do you have to look pretty for dermatology because you're gorgeous? Well, that's a very sweet question. You do not have to look pretty to go into dermatology, but I appreciate whoever wrote this question. Dermatology, though, I mean, you are looking at the skin, the hair, the nails, so it's important to be presentable, especially during interviews and during away rotations, but prettiness is subjective, and everyone is pretty in some way.